In the name of Allah, today we are going to study the peritoneum. You can see this is a transparent looking serous membrane, a glistening one, and it occupies your abdominal cavity and rather extending high up to the inner surface of the diaphragm above and down up to your pelvic cavity, and it also invests the viscera. And when you see that it is present against the body walls, anterior and posterior abdominal walls, it is called as parietal peritoneum, right? And when it is present over the organs, it is called as visceral peritoneum, right? Now in this transverse section, in which I have to mark that this is the anterior aspect, this is the posterior aspect, as you can see the vertebra over here, and the blue color marking is showing the peritoneum, and as they are being covering the organs inside, like this is the liver, this is the stomach, and you find the spleen over there. They are all those structures that lie inside the peritoneum and being covered by the visceral peritoneum. And what else you see? You see that there are other organs as well. These are present. You can see posterior to this blue line, which I am marking with the purple color. These organs are labeled as retroperitoneal organs, right? Now another important thing, in the picture you can very well see that there lies the coils of intestine, and we should know that the visceral peritoneum can be presented as a mesentery, as a mesocolon, as a mesogastrium, or in the form of various ligaments, right? Here you can see that there lies the mesentery proper, that is holding or is attaching to the coils of small intestine, right? This is the picture of the posterior abdominal wall. Here the parietal peritoneum is being removed and all organs you are looking into are retroperitoneal. Here I am interested to show you the extent of root of mesentery. So let's see that here the root of mesentery, which is 6 inches long, lying obliquely and starting from the duodenojejunal flexure up to the right sacroiliac joint. And what is going to happen, that root of mesentery has to cross what? It has to cross the third part of your duodenum, the aorta, the inferior vena cava, and then the right ureter and the right psoas muscle, right? These are the structures lying posterior to the root of mesentery, which is marked here in yellow color to show the oblique extent of the root of mesentery. Now here you are looking into the mesentery. Its free border is being shown, which is almost 6 to 7 meters long and should be attached to the coils of the small intestine. And root of the mesentery, we have already discussed its extent and its attachment. So here is the free border of the mesentery, and it is formed by the visceral peritoneum that behaves as a serous coat. And the contents we observe here could be the superior mesenteric artery through its branches, right? And definitely the veins side by, and we can expect the autonomic nerve plexus and lymphatics or lacteals inside lymph nodes, and fat, of course, right? Again another important picture, and this is showing that the main feature along the lesser curvature of the stomach. You can see this apron like structure is the greater omentum, and it is being cut in the middle to show you its 4 layers. We should know that its first layer goes downwards and becomes the 4th layer, and its inner second layer becomes the 3rd layer when it touches the transverse colon. And here lies the lesser sac, and this is the area of the epiploic foramen, and we have to discuss its boundaries, right? Now here in the picture you can see that a surgeon is holding the lesser omentum and putting his fingers through the epiploic foramen, a place where the lesser sac and greater sac, they both can communicate. And if we have to learn the boundaries, so let's see that its free edge is inside the hand of the surgeon, you would say, and posteriorly there must be lying the inferior vena cava, which is being hidden. And if we have to learn its superior boundary, we can see the cut edge of the liver, which can be showing the caudate process marking its superior boundary. And inferiorly, of course, there would be the part of duodenum, which is the first part, and it completes the inferior margin of the epiploic foramen, right? Now this is the sagittal section. I have drawn you to show you the parietal peritoneum and the visceral peritoneum. Actually, it is the game of visceral peritoneum that behaves at some places in the form of ligaments, and it also present as various omentum, and also in the form of mesentery and the form of mesocolon, and you can observe it as a mesogastrium. So it means the name of the visceral peritoneum changes according to the location and the formation of the structure it is going to attach with, right? Now this is the sagittal section, and how we are going to learn that what structures are present and how they should be drawn in the picture. So first see, there is the liver, and then just below it you find the stomach. Then you observe the third important structure or landmark is the transverse colon, and fourth one is the small intestine, right? So learn through the mnemonic that you take L from the liver, S from the stomach, and then take the T from the transverse colon and S from the small intestine, right? And how to memorize? You can make the mnemonic longitudinal section and transverse section, right? In this way, you will draw the structure, the liver first, the stomach then transverse colon and the small intestine, right? Okay, in the lower region, in the pelvic cavity, how you will memorize the placement of the organ. So from posterior towards anterior, just see the rectum is there, then you see the uterus is there, and then comes the urinary bladder. So make the mnemonic R U B. Of course, the B is for the urinary bladder. So make the word rub so that you may recall what structures should be drawn in the sagittal section. This is the sagittal section of a female body, but if you can draw the male organ, just you have to remove this, and if you want to draw the pouch here, you will name it as vesico-rectal pouch, right? Now you are looking into the transverse section of the abdominal cavity being marked with the red line. This is anterior abdominal wall and this is the posterior abdominal wall, and the organs you can see are the stomach in the middle. This is the liver being drawn. This is whole schematic representation. This is the spleen. Now the marginal peritoneum is the parietal peritoneum, right? And the peritoneum that is covering various viscera, they are the visceral peritoneum. Now concentrate on the stomach, that the peritoneum present anterior to stomach is called as ventral mesogastrium, right? And the peritoneum posterior to stomach is called as dorsal mesogastrium, right? And what is going to happen that now liver has come in the way of the ventral mesogastrium, right? And now again dividing this ventral mesogastrium into anterior part and the posterior part. Let me tell you that this posterior part is forming the lesser omentum, right? Now concentrate another thing, that the anterior part of this ventral mesogastrium is going to give rise various ligaments of the liver, like falciform, the triangular ligaments and the coronary ligaments, right? And what is the result of this dorsal mesogastrium? Again, with the engulfment of this spleen in this visceral peritoneum, that has become the dorsal mesogastrium, again dividing it into the anterior and the posterior part, right? This dorsal mesogastrium I am talking about, right? Now this is going to form the greater omentum, right? Because you can see the stomach, and if you concentrate, this is its greater curvature, and here you get the greater omentum. And the posterior part of it is supposed to give rise again various ligaments, like we can say gastrosplenic, linorenal, and we can also mention that the ligament between this stomach and the above diaphragm, you label it as gastrophrenic ligaments. So this is the story of the transverse section. So see, this is the sagittal section of the abdominal cavity to show you parietal peritoneum, visceral peritoneum and the peritoneal cavity. And what important here is, this is the anterior abdominal wall, this is the posterior wall, right? And the vertebrae are being shown here, right? And we can see that this is the parietal peritoneum, and visceral peritoneum is doing what? It is enclosing various section of the small intestine, the coils, right? And this is the transverse colon, this is the stomach, and this is the liver. Now what we have to learn, we have to see that the part which is present here in between, we would say the liver and the stomach, is the lesser omentum, and here the greater omentum is being shown, which is attached in between the stomach and the transverse colon, right? And what else you have to notice, that the sac which is formed anterior to the you would say stomach is the greater sac, and the sac which is marked with the blue color is the lesser sac present behind the stomach, right? And in female we see that this peritoneal cavity can communicate with the exterior through the uterine tubes and vaginal wall, of course, but in male the peritoneal cavity is a closed cavity, right?